can at least tell you a little bit about myself. So I was born and raised here in Vermont, in East Montpelier, about 2.5 miles up the road. My dad was an English teacher at Montpelier High School for many, many years. And I worked for Blue Cross Blue Shield of Vermont for 26 years before moving on to MVP Healthcare, where I worked for 5 years. And then when MVP Healthcare decided not to offer their Medicare Advantage plan in Vermont anymore, I lost my job, so started working with Affiliated Associates, which is a broker agency that I had worked with while I was at Blue Cross. The owner of the business is Stephanie Pigeon. She's been in business since 2000, and we do a variety of things. I'm the Medicare specialist in the office, but I also do small group and large group sales. We do pet insurance, dental, vision, travel insurance. We do all identity theft, legal shield. We do all sorts of things. And I primarily work from home in Barrie, but I do. I'll leave some on the table.
Thank you.
You're welcome. And when you look at the business card, you're going to think, what are they, dog grooming, dog obedience? But my boss is a huge animal lover, specifically dogs. So when she created her logo 20-something years ago, she used dogs to create her logo, tying each one into her 4 pillars. So there's education, there's technology, there's 2 more that I can't ever remember. But so that's the significance of the dogs within the logo.
All right.
I'm just giving people a few more minutes. I'll start right at 6. And if the library has time after October 1st, I'm happy to come back to discuss the specific changes and options. But for you guys, if you don't want to come back, you have my card, so you can always email me or call me.
Is that Orca?
Yeah.
Hi, Orca.
I'm like, is that
We
who?
can expect this to be on.
Yeah, we'll look on the Orca page probably within the week.
Thank you.
Yeah, of course.
And then
Asking questions.
we usually link to their video on the event page from our site, so you can go look at that in a week or 2, and it'll be connected.
Great.
Hello.
Always the front row.
Where everyone tries to avoid. I'm one of those people too. All right, well, it's just about 6, so I'll go ahead and get started. So again, Catherine Ruda, I'm with Affiliated Associates. We're an independent broker agency. We're actually based out of Williston, but we also have another location in Crossville, Tennessee. There's 8 or 9 of us who work for the agency. I'm licensed here in Vermont, as well as Tennessee and New York. The owner of the business is licensed in 10 or 12 different states. And we do a variety of things at Affiliated Associates, as I was mentioning earlier. I'm the Medicare specialist within the office, but I also work with small and large groups to help them with their employee benefits. We also assist individuals with needs from travel insurance, pet insurance, legal shield, ID shield, all sorts of things, so a variety of things. Unfortunately, I cannot talk about the changes that are coming up for 2026 until October 1st. Those are CMS guidelines and regulations, so this is really just an educational session on Medicare. If anyone does have specific questions about the changes, feel free to give me a call or send me an email on or after October 1st, and I'd be happy to chat with you about those. So again, I know some of you are already on Medicare, somebody's coming close to joining Medicare. Are you 2 already on Medicare, or are you 3?
I'm coming up.
Coming up, okay. So with Original Medicare, so this is meant to be an educational session. I want it to be interactive, so if you do have questions, feel free to shout out, raise your hand, whatever you prefer. With Medicare, hello, there are two original parts of Medicare. There's Part A and Part B, both of which are administered through the Social Security Administration. Part A covers somebody if they're hospitalized, whether it's in a general hospital, a nursing home, a mental health or substance abuse facility. Part A also covers you if you need home health or hospice services. And generally, there's no cost to Part A when someone turns 65, because as long as they've worked and paid into Social Security for at least 40 quarters, or 10 years through payroll deductions, that will cover their cost of their Part A of Medicare. If somebody is already drawing Social Security when they turn 65, they will automatically be enrolled in both Parts A and B of Medicare. If you are not yet drawing Social Security when you turn 65, you will have to sign up for Parts A and B of Medicare. And you can do that either by calling Social Security, making an appointment to visit them online, or signing up through their website, which is ssa.gov. Yes?
What happens if you're not eligible for Social Security?
Well, that's a good question. Sometimes, if you're not eligible through your own work experience, you can sometimes get credits through a spouse, either a current spouse or an ex-spouse. If you've been married long enough and are divorced, a lot of people will still qualify through a former spouse and be able to enroll. And depending on how long you may or may not have worked, you may still be eligible, but you may have to pay a premium. And that's something you'd want to contact Social Security about. There are some people who can buy into Medicare Part A. Part B of Medicare is the other primary part of Medicare that's administered through Social Security. Part B covers pretty much all of your day-to-day medical services. So emergency room visits, doctor's office visits, urgent care visits, lab work, x-rays, specialty visits, medical equipment, things like that. And regardless of how long someone has worked and paid into Social Security already, there is a cost for Part B of Medicare when you enroll. The cost for this year, for 2025, is $185 a month. Well, I should say it starts at $185 a month, but can be higher depending on what you file for an annual adjusted gross income. If an individual's income is greater than $106,000 a year, or their joint income with a spouse is greater than $212,000 a year, they will pay more than the $185. And those amounts are indexed, so they do increase. For the majority of the time, they do increase every January 1st. So not only those income thresholds, but also the Part B premium amount does increase. Yes?
Is that automatically deducted from Social Security monthly?
If you are drawing Social Security, yes. Once you become eligible for Part B of Medicare, Social Security will automatically deduct that from your monthly Social Security check. If you choose to defer your Social Security benefits until 67, 68, 70, but you still sign up for Medicare at age 65, Social Security will bill you the Medicare Part B premium on a quarterly basis. So the 185 times 3, and it will come in a paper bill. If someone chooses not to sign up for Medicare Part B when they turn 65, they could be subject to penalties. Those individuals who are not subject to penalties are people who are still working full-time for a large group employer, and they define large group as 20 or more employees. If you are working for an employer who has more than 20 employees and you are covered by that employer's health plan, you can remain on that employer's health plan for as long as you continue to work and defer your enrollment into Medicare without any sort of penalty. But everybody else really needs to sign up, or you could be subject to penalties. And the penalty is 10% of the Medicare Part B premium for each year that you don't enroll. So what they would do is, Let's say you go 1 year without signing up, the current premium's $185, they would tack on $18.50 to your Part B premium going forward. So it can be pretty significant. With both Part A and Part B of Medicare, there are deductibles. So the deductible for Part A currently, and these again are indexed by CMS, so they do tend to go up every January 1st, it's $1,676 per hospital admission. So if you're hospitalized 5 times in a year, you can expect to pay that deductible all 5 times. The exception is if someone is readmitted for the same condition within 60 days of an original admission. So if someone goes into the hospital because they've suffered a stroke, they're in the hospital for 40 days, they get discharged, and then 28 days later, they have to be readmitted for symptoms that are related to that stroke, they will not pay another deductible.
But you said it was 60 days.
Right, but that's 28. So if it's been 60 days, then they would have to pay another one.
Or 59.
So yes, if you are readmitted within 28, 59, however many days, if it's less than 60, you will not pay another deductible for that same admission if it's related to the same condition. But if more than 60 days has elapsed from when you were discharged and then when you're readmitted, you would have to pay another deductible. There are also per day copays for Part A services. So again, Part A is hospitalization, home health, and hospice. And so if you don't have a supplemental plan or a Medicare Advantage plan, someone would have to pay those copays out of their pocket. With Part B of Medicare, so that's the piece of Medicare that most people tend to use because that's your day-to-day office visits and emergency room, labs, x-rays. The deductible is $257 this year. And then after someone has met that deductible, Medicare pays 80%. So if someone chooses just to have Medicare A and B and no supplemental and no Medicare Advantage plan, you can expect to pay those deductibles out of your pocket each year if you incur services that fall under those categories, as well as those per day copays and the 20%. There is no maximum out of pocket with Medicare. So what that means is that there's never a point at which Medicare covers you at 100%. So that's why people then start shopping around for plans known as Medicare Advantage, which is also known as Part C, or Medigap, which is also known as Medicare Supplemental Plans. Medicare supplemental plans or Medigap plans, not to be confusing, but they are designated using letters as well. So the original parts of Medicare are Part A, Part B, Part C is a Medicare Advantage, Part D is the drug plan, but then when you get into supplemental plans, those are known as plans, and there's Plan F, Plan G, Plan N, I know. Gotta love the federal government. And regardless of which insurance company you go with a Medicare supplement or Medigap plan, the benefits are the same. And what I mean by that is if Plan G is the best option for you, Plan G is gonna be the same whether you go with Blue Cross Blue Shield, Aflac, Cigna, State Farm. Same with Plan N, Plan F. The benefits will be the same. Right now, depending on when someone has turned 65, Plan F and Plan G are the top of the line Medicare supplements that are available on the market. Plan F is available for anyone who turned 65 prior to January 1st of 2020. Plan G, and then it was discontinued, so only people who turned 65 prior to January 1st of 2020 can still enroll in a Plan F. Everybody else who turned 65 after January 1st of 2020, the best supplemental plan on the market is Plan G. The premiums, what will vary when you're shopping around for supplemental plans will be the company's customer service experience, the rates, so the premium that you pay each month, their claims processing experience, and just the overall company's reputation. That's what will vary, but again, the benefits will be the same regardless of the carrier you go with. With a supplemental plan, like Plan F, G, or N, if Medicare, who will be the primary insurance, if they determine that something is not covered, and it's rare, because Medicare typically pays most services, some of the things they don't pay for are cosmetic procedures, like someone needs Botox for something. Sometimes they do cover Botox if it's related for a medical condition, but they don't cover it for cosmetic reasons, obviously. They don't cover nursing home care for chronic conditions. So someone's diagnosed with Alzheimer's or something to that effect, where they just need assistance with daily living, that's not going to be covered by Medicare.
What about joint replacements?
Yes, that is covered.
Okay, and that's not with the supplement, that's basically with,
So Medicare would pick up they would act as primary, so there's a deductible,
okay.
and then they would pay, and then they would pay 80%, and the supplement would pick up that 20%.
The supplement.
Yes. So the
Okay,
Plan
got
F
it,
for the Plan
got it.
G, that would pick
But
up
I
the
could-
supplement.
But I could still get a hip replacement under Medicare if I was ready to pay for all of that without the supplement.
Yes, you could. Yep, and Medicare would pay 80%. So you would just,
Just
Yep.
to get that a couple thousand.
yes, you would just have to be prepared to pay the 20%.
So I heard that they don't cover acupuncture. How would you pay, would the supplements pay for that?
It would not.
No.
Supplements follow Medicare guidelines, so, and that is correct. Medicare does not pay for naturopathic services, including acupuncture. So that means a supplemental plan would not pay for that either. Yep. Maybe someday they will change, since that's becoming more and more popular, but they do cover chiropractic services, but only in certain situations. It's usually only for manipulation of the spine. So some people go and see acupuncturists for headaches or neck or something else. That would not be covered. They're very specific. Yes, sorry, chiropractor. Yes, they're very specific with what they allow for chiropractic services. It's really just manipulations of the spine. Medicare Advantage plans are the alternative to Medicare supplements. And the way that a Medicare Advantage plan works is that commercial carriers such as United Healthcare, Blue Cross Blue Shield, in other states there's more choices, but what they do is they take the benefits that someone's entitled to under A and B, which is pretty much hospitalization and physician services. They usually take the Part D, which is drug, and they package it all up into one plan, and that becomes your Medicare plan. So instead of Social Security or Medicare being your primary insurance and you having a supplement and then a separate prescription plan, if you opt for a Medicare Advantage plan, that becomes your Medicare plan.
There is no A and B?
Your A and B is part of that Advantage plan. So the benefits that you're entitled to under A and B become part of that Advantage plan. So you still have to pay your Medicare Part B premium to Social Security, but the Medicare Advantage plan becomes your Medicare plan. I know, very confusing. The advantage to Medicare Advantage plans is that the premiums are usually much lower than with Medicare supplements. With a Medicare supplement, you're looking at anywhere from probably $150 to $300 a month for a Medicare supplement. Medicare Advantage plans are anywhere from 0 to 100 in this state. And that's because the plans are subsidized by Social Security. So because the commercial carrier becomes your Medicare plan, Social Security or Medicare isn't taking on any risk, meaning they're not paying out any claims on your behalf. The commercial carrier, such as Blue Cross and United, are the ones paying out the claims. But Social Security is still collecting premiums for you for Part B. So they turn around and subsidize the premiums of the Medicare Advantage plans. And then depending on how much money the commercial company is getting from Social Security, they then determine whether or not they have to collect additional premiums from members to cover the costs. Does that make sense to everyone? I know, it's very confusing. They make healthcare more confusing the older we all get, that's for sure. With a Medicare Advantage plan, instead of Medicare paying as primary and Medicare Advantage as secondary, the Medicare Advantage plan is your Medicare plan. And so the way that that works is that there could be deductibles under that plan, but more than likely there are just copays. So every time you incur a medical service, expect to pay a copay, and the copay amount will vary depending on what it is you're having done. The lower cost service, the lower the copay. Obviously, hospitalization is the highest price item under a medical plan, so if someone is hospitalized overnight, that's where they can expect to pay the highest copay, and it's usually a per day copay.
Do citizens, clients, Medicare recipients have access to anybody who could estimate costs before you went and did something that was fairly elective? Like somebody who could list all of the potential and add it up in this system?
To some extent. They don't have specifics. They usually have ranges of prices, and it's usually just for those highest incurred medical services. It's not for everything, but usually it's the company website. So if you're looking at a Blue Cross Blue Shield Medicare Advantage plan, they have tools on their website to help you estimate your costs. They will ask you general questions. How many emergency room visits do you expect to have? Do you have any upcoming surgeries? Have you been hospitalized? Do you expect to be hospitalized? Do you have any, how many times in the past year have you used an urgent care facility?
What about Medicare straight? Is there anybody in the Medicare non-supplemental who could answer that question?
No.
Better to know than to be on the phone for 3 days to nowhere.
No. It would be nice, but no. I will say the Medicare reimbursement rates are much, much lower than what people are used to through commercial insurance. So what providers and hospitals are reimbursed by Medicare are much lower than what you, or what hospitals and doctors get if someone's on Vermont Health Connect or a plan through your employer. And so typically there's a savings to you as the member, especially if you're on a supplement. If you're on a supplement, you generally don't have any out-of-pocket costs other than your premiums. But if you're looking at just doing A and B and not picking up anything else, the hospital might be able to help you. So if you have, they usually have the financial services. Yes, the financial services at the hospital can help you. And they, because the Medicare rates are standard, they usually know. Unlike, if you have commercial coverage and you're having shoulder replacement, the rate that you get from Blue Cross is going to be different than what they would get from Cigna and from MVP. But with Medicare, the Medicare rates are the rates.
Thank you.
Yes. So with the Medicare Advantage plan, again, typically copays, there are out-of-pocket maximums that are built into these plans, meaning if someone's really, really sick in a year and they expect to incur a lot of copays, there is a point at which if they pay a certain amount that the insurance company will pay 100%, so you're not going to lose thousands and thousands. The out-of-pocket maximum is usually anywhere from $5,500 up to $7,500, depending on the plan and the company. There are some benefits under an Advantage plan that won't have copays, that are paid at 80%. So if someone incurs these expenses, they will be paying 20% of the costs if they elect to have a Medicare Advantage plan. Again, the 20% that they're paying will accumulate towards that out-of-pocket maximum under the plan, but they will certainly hit that out-of-pocket maximum in the year because the services that are paid at 80% are dialysis, chemo, radiation, durable medical equipment, so things like walkers, hospital beds, wheelchairs, and Part B drugs. So Part B drugs are not drugs that you go down to Kinney Drugs or CVS to purchase. Part B drugs are infused, usually in a hospital or a doctor's office setting. So they're usually immunosuppressive drugs. But the Medicare Advantage plan will most often also include the Part D drug benefit that someone needs to have as well. Some of the disadvantages to a Medicare Advantage plan is that there are more hoops to jump through. With Medicare, as long as it's covered, you don't need to get prior approval. You don't have to worry about a network. As long as the doctor or hospital accepts Medicare or it's an emergency situation, it's covered. With Medicare Advantage plans, they're administered by commercial carriers like Blue Cross and Humana and United, and the plans will go by their rules. So they can determine whether or not they want to allow or require prior approval or pre-authorization for services. If they want to deny something, they can deny something. Yep.
Is it true that they have sort of a sliding behavior with regard to that, where they are more likely to reject something as a person gets older and less likely when they're first into the plan, just to make the customer feel good at first for the first couple of years, but as they get on in years?
I've never heard that. I've never heard that. Maybe in other parts of the country. I've heard horror stories about Medicare Advantage plans in other part of the country, especially in the Midwest or the southern regions. Here, the Medicare Advantage plans, because they've only, the two biggest ones were MVP and Blue Cross Blue Shield, and they both have a pretty good reputation for their plans. I haven't heard of that. I will tell you that if someone elects a Medicare Advantage plan here in Vermont, if something happens and you decide 2 or 3 years from now, this isn't working for me, I don't like the way the plan's working, I'm having to pay more out of pocket than I expected, or your health care changes, and you become sicker and you want to switch to a Medicare supplement, it will be harder to do so, because in Vermont, Medicare supplements are medically underwritten. And what that means is that if someone tries to enroll in a Medicare supplement after they first became eligible, so this doesn't apply to people who are newly retiring or newly going on to Medicare. These are people who've been on a Medicare plan for years. The insurance companies who are offering those Medicare supplements can underwrite the plan. And what that means is that they will ask you a series of health questions during the application process, and based on your answers, they could deny you coverage or charge you a higher premium. But I haven't heard about that happening with, we'll just pay everything now. Because, so again, I worked for the insurance companies. They have to have their computers built the same for everybody. And so if something's going to deny, it will most likely deny for everybody. They don't have it built in by age or when you became a customer or anything like that. Let's see, what else? Part D. Part D is the drug piece. And again, a lot of people are like, well, I'm not taking prescriptions, or I just use like supplements, herbal medication, so I don't need to get a Part D prescription plan. That's fine, but if something happens down the road and you all of a sudden need an expensive medication like Eliquis for blood pressure or Humira or something like that, and you try to enroll in a Part D prescription plan, you will incur a penalty. So the government assesses a penalty for Part D if someone does not enroll when they first become eligible. And they take the average Part D premium, which is about $34 a month, and you pay 10% of that, for each year that you don't enroll.
So I got strong-armed into purchasing Part D because of exactly that. At the end of the first year,
Okay.
I had this penalty. I'm like, what is this? They said, well, you didn't sign up. So whatever I signed up for, it was like only a couple of dollars a month. So what did I sign up for as a person who doesn't take any conventional medication?
So did you not sign up for a Part D plan when you first turned 65?
First turned 65.
But then
when
someone-
I got to 66 or whatever,
Somebody convinced you to enroll in WellCare.
something.
Yeah, probably WellCare.
Yeah, okay.
And so because you did not sign up for a Part D prescription program when you turned 65, but then did at 66, you're now having to pay a penalty for that first year that you did not have.
Right, and it's a penalty that
For the
continues
rest of
for
your life.
yeah, and it's how much you said? There's like this number you.
It's
just
not a
gave.
whole lot.
Oh, no, it is, over your whole life.
Over
I'm
your whole
sorry.
life, yes,
Let's just
yes,
Because we're talking
Yes.
evil now.
yes,
I'm gonna name it this is evil. Okay.
yes.
So for the rest of my life, I'm paying a higher something because for that first year, I didn't know I had to have the medical coverage, and it'll go for the rest of my life.
The rest of your life, the rest of your life, as long as you continue to have a Part D prescription plan. I mean, you could go back to dropping the Part D prescription plan and not pay the penalty, but if something happens and you need prescription coverage and you go re-enroll, then it's going to be an even higher
Even
penalty.
higher.
Yes.
I can't even imagine who thought these things up.
And so many people when they turn 65, or, well, I wouldn't say this, but a large amount of people who turn 65 are on Vermont Health Connect. And they think, okay, well, I'm getting subsidies and I'm not paying a lot. I'm just going to let this continue. And they stay on Vermont Health Connect. And then the first year after they've done that and they file their taxes, they end up having to pay back the subsidies that were paid on their behalf, because Vermont Health Connect does not automatically kick people off unless you stop paying your premium, but they do not automatically kick you off when you turn 65. They're relying on people to know that they have to contact them to disenroll and to sign up for Medicare. Yes. So just be wary of that if you are coming up on your 65th birthday and you are not covered by an employer plan and your employer does not have more than 20 employees, you do need to sign up for Medicare A, B, and D in order to avoid penalties. The supplemental or the advantage is optional. If you don't sign up for a supplement, you're not going to be penalized. You're just going to be paying 20% of your incurred medical expenses out of pocket.
Part C is separate from the
Part C,
Advantage and supplement, or could those include Part C?
Part C is a Medicare Advantage plan. It's one and the same.
But it includes the D drug?
Sometimes. It depends on, so again, commercial carriers like Blue Cross and Humana and United Healthcare offer Medicare Advantage plans. And some of the Medicare Advantage plans that they offer include Part D. And when you look on their website, it will very clearly say with Part D or without Part D. So some plans do not have Part D.
How about just a supplemental plan that is not Advantage?
Supplementals do not cover drugs at all. So if you go with a supplement, you will also have to sign up for a Part D prescription plan. Yes.
Where would you, I mean, a Part D prescription plan is not on the Social Security website. Where would you sign up for it?
Medicare.gov. Medicare.gov is your best resource.
To sign up for Part D?
Yes. So if you go out to Medicare.gov, there's a link up in the top right corner that says Find Health and Drug Plans. If you click on that, it will ask you to enter in your zip code. Once you've entered in your zip code, you have the option of 3 different radio buttons. It says Medicare Advantage, Medigap, Medicare Part D. And you can choose what it is you want to look at or compare. So you can choose Part D. It will ask you if you get any extra help from things like Medicaid or the Medicare Savings Program, V-Farm. We can talk about V-Farm in a minute. Anything like that, you can say yes or no. And then it will ask, do you want to see your drug costs under these programs? And if you want to enter in the prescriptions that you're currently taking, you'd hit yes, otherwise you'll hit no. If you hit yes, then you can enter in all the prescriptions that you're currently taking, and it will estimate what your costs are based on what you enter. It will give you the premium for each plan, and then it will estimate your total out-of-pocket costs under each plan based on your drugs. That total out-of-pocket cost will include the monthly premium. So when you're looking at the total annual expected costs, that's your deductible, your copays, and your monthly premium. Just know that if you use the tool right now, The results are only going to be based on the last 3 months of the year, October, November, and December, because the tool is built on estimating costs on a calendar year basis. And so you won't be able to estimate it for a full calendar year until probably October 15th. And then after October 15th, it will ask you, are you looking for 2025 or 2026? And if you enter in 2026, you'll get the entire year of expected costs, where if you look at 2025, you'll only get the remainder for the rest of this year.
Are you locked in if you pick one company for your Part D? Are you locked into that company forever?
You are not locked in to that company forever, no. So you have two opportunities to change. You have basically October 15th to December 7th, which is the Medicare open enrollment period. That's when you can make changes on your Advantage plan. That's when you can change your Part D. And then there's a second open enrollment period in the first quarter,
The first one is October 15th to when?
December 7th.
And the second, now you're saying?
And the second open enrollment period for Medicare Advantage and Part D is the first quarter of each year, so January, February, March.
That applies to people with existing plans, right?
Correct.
I'm new, my birthday is in February, so I wouldn't have to care about this October 15th to December 7th.
So you turn 65 in February? Okay. So yes, you have different circumstances. So that October 15th to December 7th applies to you next year if you want to make changes, bless you, but will not apply in February. So for you, you have a 3-month window prior to the month, and you weren't born on the first of the month, were you?
No, not.
Okay. And the reason I ask that is because that's another misconception for people. So people are typically eligible for Medicare the first of the month in which they turn 65. And you have a 3-month window prior to when you turn 65, so 3 months prior to the first of the month in which you turn 65, the month in which you turn 65, and 3 months following the month in which you turn 65 to sign up for Medicare without any penalty. So you have that window to sign up for A and B without any sort of penalty. People who are born on the first of the month are actually eligible for Medicare on the first of the previous month. So if you were born February 1st, you would actually be eligible for Medicare starting January 1st. And not a lot of people understand that. So that shifts that 7-month window. So a lot of people miss it because they're going by the first of the month in which they turn 65 instead of the first of the prior month. Yes.
Is that, I'm sorry, the window is also for Part D?
That initial eligibility window when you first turn 65, yes, is for Medicare A, B, Supplemental, Advantage, and Part D. You have that entire 7-month window. And if you sign up, so let's say, again, his birthday is February 11th. He becomes eligible for Medicare February 1st. You sign up for your Medicare A and B. You pick a plan to have in place a Part D and a Supplemental for February 1st. And as of April 1, we'll say April 1, you're like, I don't like this plan. You still have until the end of April to switch your Part D and your supplemental plan without any sort of penalty or without having to wait for the next open enrollment period because he's still within his 7-month window. But then if you wait until, and you actually have until the end of May because 90 days following April 1st. But if you wait until July, then you're kind of locked in until the open enrollment period, which again is October 15th to December 7th of every year. And the changes that you make during that window will go into effect January 1st. There's not really a window with the Medicare supplemental plans, except that you may be subject to that medical underwriting if you change from an Advantage or original Medicare into a supplemental plan. So, I've thrown a ton of information at people. What questions do people have that I haven't yet covered?
Can you talk about the Medicare savings program?
Sure.
What does that
So the Medicare Savings Program and V-Farm are both programs that are income-based. So people whose income falls below a certain level may be eligible for these programs. The Medicare Savings Program here in Vermont is administered through the Green Mountain Care Board. So the same entity that handles Medicaid and really the Vermont Health Connect. And so they can help with eligibility. And so if your income is below a certain threshold, the Medicare Savings Program can help pay your Medicare premiums as well as your supplemental and Part D premiums. And then V-Farm, and it's V, P as in Peter, H-A-R-M, so it's not V like farm, like old McDonald. V-Farm is a pharmacy assistance program here in Vermont which is intended to help people who are taking a lot of prescriptions, helping to pay them with their out-of-pocket costs. So again, it's income-based. The income thresholds for V-Farm, though, are fairly high compared to the Medicare Savings Program. The Medicare Savings Program threshold here in Vermont is very low. V-Farm is higher. The way V-Farm works is, depending on where your income falls, you pay a monthly premium to have V-Farm, and it's either $15, $25, or $50 a month. But in return, V-Farm will cover your prescription expenses, with the exception of $1 that you would pay for any generic drug you're taking, or $2 for any brand name drug. A lot of the hospitals, especially like University of Vermont Medical Center, Central Vermont Hospital, and Porter, they also have financial assistance programs that can help people under a certain income threshold cover their medical expenses as well. It's called the Hospital Assistance Program. And so if you incur services at those hospitals and your income is below a certain amount, they have programs that can help cover the expenses that you incur there, as well as prescriptions that you get from the hospital pharmacy.
Can you talk a little bit about what happens if you move to a different state?
Sure. So the Medicare Advantage plans are really regional plans. So if you elect to be on a Medicare Advantage plan and you move, you are going to be required to select a different Medicare Advantage plan or enroll in a supplement in the state in which you move to. You have 60 days from the date you update your address with Social Security to make that change. You don't have to wait for an open enrollment period. If you're on a supplemental plan, again, the supplemental plans are the same whether you're here in Vermont or you live in Kansas or Florida. Plan G is Plan G. So they're a little bit more flexible on letting you keep that plan in the state where you initially enrolled. And as long as a provider accepts Medicare or it's an emergency situation, it's considered a in-network benefit under a supplemental plan. What other questions?
If you wanted to actually talk to a real person, is the Social Security building open for like having like an office visit to talk to someone?
They do. So I have a good friend who works there, and she said that she can help you with, A and B and enrollment with that, but that's where it ends. They have nothing to do with Medicare Supplemental, Part D, or Advantage plans.
Are they still open in town? Or are they
Yeah, she is. You might want to call them and just ask about scheduling an appointment with them.
I wouldn't just know.
But yeah, because I know they're not always fully staffed, and so they maybe close certain hours. And I know they have to cover the national 800 line as well in some cases, so they're not always available.
This is all new for them, I guess. It's much harder on that.
Yes.
Also, Council on Aging helps with a lot of different things.
They do. Council on Aging's great. There's 5 of them in Vermont. The closest one to here is in Barre, right near Cornerstone, the Central Vermont Council on Aging. I worry a little bit because last year when MVP left the state, they did become overwhelmed and they stopped being able to assist people soon after open enrollment started, because they just didn't have the manpower. I mean, 25,000 people lost their Medicare Advantage plan last year, and they did their best, but like most people, they have limited resources, so they help as many people as they can, but yes, they are a great resource as well. What other questions? And certainly you can take my business card, so if you think of something afterwards, either that I didn't cover, that you still have questions on, if you want to contact me on or after October 1st about upcoming changes for 2026, if you want me to help you compare plans after October 1st, any of that I'm happy to help with.
Will you be doing this again here after October 1st?
If they had some available time, I would love to. I just figured it would be good, so if people want to come and just have a base understanding of Medicare, and that way when, they have to start comparing plans, they at least have a base knowledge of what they need to look at or what they're interested in.
So let's think apocalyptically and say that the government shuts down at the end of September. What would you see happening at the state level here to all of us?
Well, that's not going to happen, because if it were, that would have already had to have happened. Companies have to file their rates and what they're planning to do for the upcoming year early in the year. So if that were going to happen, and I work for a small independent agency, I can't control what would happen to the government, so I don't know what would happen in that case.
So I think you said that the Medigap companies are not the same companies that do Medicare Part D. So you would if you were going to do Medigap, you might sign up for Plan G. But you also need to go to somewhere else to find
Part D.
Part D.
Yes, sometimes they are. Like Blue Cross Blue Shield, having worked there, I know that they currently offer Medicare Advantage, they currently offer Medicare Supplement, and they currently do offer Medicare Part D plans. Whether that will continue, I don't know, but currently they do.
Yes, I guess for clarity, then you need to make sure you know what you want to get when you talk to them.
Yes, and so I don't even have rates yet for next year. I will get those the same day they become available to everybody else on October 1st. And hopefully Medicare.gov updates their website soon after, if not on the 1st, so that everyone can see what the updated rates are there as well. You can't actually, if you're currently on an existing plan, you can't actually make any changes until October 15th, even though you can review what everybody is offering as of October 1st, unless for some reason your plan is being discontinued. If your plan is being discontinued, either because the carrier is leaving Vermont or they're just discontinuing what they offer, then you can make a change beginning on October 1st. And you are also not limited to that December 7th date either.
So I turned 65 in November.
Okay.
So I could go online now and I can find out what the rates are for this year, right? And I want to sign up because I will need that insurance starting 1st of November. But that's also open enrollment period. So I could change my mind about who I want so that for 2026, I have somebody else.
Correct. And the open enrollment doesn't even apply to you because you're turning 65, yes.
Because I have 3 months
Yes.
after. But if I want coverage starting in November, I've got to sign up.
Now, and then if you see something better or the plan you picked is going away, then yes, you can change for January. Yes.
Did you happen to attend Senator Welch's town hall meeting that happened about, I don't know, maybe 3 weeks ago up in the formerly Vermont College campus?
I did not.
Well, he talked all about healthcare, and he mentioned something, and don't quote me, but it was something about Humana and how something like, they let people apply for, okay, I'm sorry. Like people paid premiums for, say, an illness, and the expenses were really high, but then when they got to a certain really high point, then they dropped the people.
That probably did happen, again, not around here. So Humana is not really even an option for you around here, except they currently have a Part D plan, but they don't have Advantage plans or supplemental plans in this area. So that would have been in a different part of the country.
Okay.
But that doesn't surprise me because I do hear horror stories similar to that in other parts of the country in states that are not as heavily regulated as Vermont. Vermont is a very heavily regulated state, meaning the government is very involved in the insurance companies and the plans that are offered here in Vermont.
We're fortunate.
Yes and no. Because of that heavy regulation, we also tend to have higher premiums than a lot of the other parts of the country.
In the country, right?
Yes. I mean, again, I'm licensed in New York and Tennessee. New York's pretty comparable to Vermont. Tennessee is half, if not more than half as much as what premiums are here.
Separate question. There's a book called The Art of Dying Well. I forget the author, but and there's something in there about slow medicine. She called it slow medicine. So, like, I think the idea was, as people age, like when you get to a certain point, you won't want to have a great big surgery, invasive everything. You'll want to slow down, slow medicine. And because of that, there's a whole chapter kind of on maybe switching to, instead of the supplemental, the Advantage plans, that they're more for slow medicine. Does that make sense? I don't know. Maybe I'm not understanding it well. But you can look at that book and see
All right.
what you think.
Yeah.
The Art of Dying Well. I'm pretty
Okay.
sure that's the title.
I have heard of that book. I have not read it, but I have heard of it.
Yeah.
But I wouldn't expect an Advantage plan to be a better alternative to a supplement, even in that situation. There are definite reasons someone goes to an Advantage plan versus a supplemental. They both have their advantages. You mentioned acupuncture earlier. Acupuncture is covered under some Advantage plans, as well as some limited coverage for things like dental, vision, hearing aids, gym memberships, things like that. You will not find reimbursement for those under a Medicare supplement. Medicare supplement does not pay for dental unless someone's in an accident and it does something to their natural teeth. If they have dentures, you're out of luck. But if you still have your teeth and it's injured, then Medicare will cover. But routine dental is not covered by Medicare. Routine vision is not covered by Medicare. However, Medicare does cover medical vision, so glaucoma, cataracts, conjunctivitis, diabetes. Hearing aids are not covered under Medicare supplements, but there is some limited coverage with Advantage plans.
Question,
Yeah.
you may have answered it, and I didn't hold on to it. But if you're on Medicare, right, and you're on for years, but then you decide you want to go on an Advantage plan, and you do that for a few years, and you say, I really want to go back to Medicare. Can you?
So original Medicare, yes, you can. If you decide you want to go from an Advantage plan to original Medicare and a supplement, during the enrollment process for the supplement, that's when you're going to be asked that series of health questions because they're medically underwritten by the insurance companies. So based on your answers during the enrollment process, they could deny you enrollment into their supplemental plan. But you can always go back to original Medicare A and B. Yes.
So to follow up on somebody else's previous question, is there like a website or somewhere you could go to find out how recommended certain companies are?
So Medicare.gov, that same website, they have star ratings out there for each of the plans within each of the companies. So you'll see if they get 2.5 stars, 4 stars, 1 star. You'll see the star rating right on there.
Is that based on like Citizen Joe Schmo?
It's based on a series.
Medicare? Questionnaires?
It is based on customer satisfaction as well as some timeliness measures and some customer service satisfaction things as well, scores as well.
Is it by state, by the nation, by the company?
It's done by, so yes, it's done by each plan because what's offered here in Vermont will not be the same as what you might get down in Florida or Kansas. So it is done by each plan within each company by state. Yes.
Can you talk about mental health coverage?
Under Medicare? I mean, it's, yeah, it's covered.
Under Medicare, original Medicare.
Yep.
Medicare supplement.
Yep. Medicare Advantage. Again, with Medicare Advantage, you just have to be careful because with Medicare Advantage plans, again, if a provider accepts Medicare, then it will be covered under some Advantage plans. If you have a PPO plan, there are HMO Medicare Advantage plans out there as well. HMO have more restrictive provider network, so not all providers may be covered under that plan. They may choose to only cover certain providers. So you just need to make sure that the provider accepts Medicare. And mental health providers are one of the specialties that don't always accept Medicare. So you just have to be very careful. I've run into physical therapists, mental health, substance abuse providers, chiropractors, acupuncturists, don't always take Medicare. So you want to be careful of that. But if they accept Medicare, then it would be covered like any other office visit or hospital admission.
You had said that dental and vision are not incorporated into the regular A and B. So if we wanted these two things, we'd have to get them through an Advantage or a supplement?
You'd have, not through a supplement. A supplement will not provide coverage. So maybe something that's included in an Advantage plan, so yes, or you can usually sign up for those plans individually as well. Vision Service Plan offers individual vision plans. Delta Dental does individual dental plans.
It'll be something totally separate.
Correct. Yes. Anything else?
Thank you very much.
Well, thank you. Thank you all for coming.